I've heard that it can take a long time for the process. And, sometimes, like, I'll hear on the radio that, I can get a new tooth in a day. What do you think about that? And
there are times when we can do that. In certain cases, patients can come in and have their procedure done, and we work in concert with their dentists so that they can be provided with essentially their final result in one day. Those are exceptions, I think, to the rule, and in the typical approach to restoration of teeth with dental implants, we do everything we can to optimize the opportunity for the patient. We make sure that they're healthy, or at least as healthy as they can be made to be for it, and that the bony recipient bed is ideal for placing the implant in ideally the right position. So this requires a lot of work before we even begin to do any work. We use ICAT scans and computer-generated guides, and the digitally placed implants are really the pride and joy of our effort. Patients do so much better with well-planned implants, and even if it takes a few months one way or the other, this is a lifetime thing. And although I understand the urgency to get a tooth in place, patients never go without cosmetic teeth. And even though they're not ideal from the point of view of the patient having the final restoration, the time spent is very well worthwhile. So in some cases, we can see a patient and have them ready for a tooth that day. In sometimes it takes a couple of months. In some cases, it might take several months. Each person is different, and we need to spend a lot of time chatting with them, understanding what they need, and offering them the best treatment that we can.
That makes a lot of sense. It sounds like a lot goes into it to have it last a long time.
Well, that's the goal, and we'll do anything we can to help our patients get to where they want to be.
Do patients find, when they have an implant done, a lot of people are kind of scared about, going through the procedure. Is it going to be painful? Are they going to have to take a lot of time off work? What do you think about that?
Well, this varies. The placement of an implant in a healed extraction site is generally a pretty straightforward thing. Most people tell us it's way less troublesome for them than the extraction was. And frequently patients will come in for that kind of a procedure and be back to work the next day, comfortable. Patients who need grooming, if you will, or who need to have some preparation made for the placement of their implant to ensure the long-term success, may go through more extensive procedures, and of course those will be associated with slightly more post-operative experience. But in the main, implant dentistry is very comfortable, very straightforward, and very easy for the patient to undergo.
Well, that makes a lot of sense. What is the implant itself actually made out of?
The implant that we use today is made out of titanium or a titanium alloy, and the implant itself is extensively bioengineered, again, for force distributions and for making it easy for the bone to grow up and hold the implant rock solid where it's supposed to be.
So, will I set off metal detectors?
I've never heard of that, although I do have some friends with prosthetic joints that have a terrible time at the airport. No, and in fact, many of the questions that relate to implanted metal turn out to be not so big of a deal. For instance, some people may need an MRI down the road, and they worry that having an implant, a metal implant in their jaw is going to interfere with that. It has not been our experience that there's any trouble there, and most of the radiologists are very familiar with placement of dental implants now, since they've been around a while, and they're on the cutting edge of their work too.
So once the implant's done, am I going to be able to bite and chew normally like I do now before I lose the tooth?
Ultimately, yes. When the complete restoration is finished, we would expect you to have a restoration that looks and feels like your own tooth. you got to take care of it like it was your own tooth. In the time between the extraction and the restoration of the implant, sometimes we have to use temporary restorations that will get you through a cosmetic situation or give you some functional capability for the period of time while everything is healing or while we're waiting for the dentist to restore the tooth. But in the end, it's like having your own tooth.
That's great. Now, I know I hear a lot of people that they've had dentures for a while, especially with their dentures with the lower jaw, that they really hate them. Mm-hmm. And they've had them for years. They don't fit well. Would implants be a good way? Is there any way implants could be done to help fix that problem?
Sure. Dentures are commonly a problem for patients, and lower dentures, as well as partials, are very uncomfortable. They flop around and the patients have trouble speaking, eating, kissing their loved ones. And we hear these stories all the time about how even just a couple of implants on the lower jaw to stabilize the implant changes people's lives. And some of these stories they bring a tear to my eye because the patient has done so well and we were so significant in helping them get to this point where their lives are reclaimed. I know that sounds like a lot from a dental office, but it's true.
That's really neat. So if they are missing all their lower teeth, they don't need an implant to replace every single tooth.
No, there are a number of options that can be entertained, and this will be done in consult with their dentist. We work with their referring dentists as a team with the goal of helping the patient get to where they want to be. And for a number of reasons, we could place anywhere from 2 to 5 or 6 implants in the lower jaw and do different things for those patients. But even the most basic entry-level kind of help is like night and day over where they came from.
That's great. Now, what if someone wanted to get rid of their dentures completely? Like they didn't want to have a denture that came in and out. Is that possible to have something in there permanently?
Sure it is. The number of things that can be done to restore dentition or teeth on implants is almost unlimited. And depending upon any number of factors for the patient, we'll go forward with a plan that gets them to where they want to be. And this could be retained dentures, which they take out and clean at night like normal, but snap back in so that they're stable. It could be something that the dentist takes off every once in a while. It could be something that never has to come off. All of these options need to be explored extensively with the patient, with the restoring dentist, and of course, with us.